Hello everyone, myself Dr.Shail Gupta. I practice dentistry in my clinic, that is Shraddha Dental Clinic. People, today we will discuss about OSMF. First of all, the full form of OSMF is oral submucous fibrosis, and the etiological factor which causes OSMF are areca nut chewing. The most important etiological factor is areca nut chewing, or any kind of products having areca nut. It may be gutka, it may be in the form of pan, or simply the areca nut, with tobacco. Areca nut is one of the major factor of causing OSMF. First cause is areca nut, and second is chewing too much. Eating chilies. So eating chilies. Some people have the habit of eating too much chilies in every time they eat chilies with the food. So too much chilies also causes OSMF. Now the condition or the clinical situations which is seen after OSMF, the symptoms. If a person having OSMF, that is oral submucous fibrosis disease, they are not able to open the mouth. The mouth width is very much reduced, and it is not able, they are not able to open the mouth. The mouth opening is reduced due to the disease, that is areca nut causing disease, OSMF, oral submucous fibrosis, or the chilies, too much consumption of chilies. So the mouth is not able, the patient is not able to open the mouth. And second is the most fatal condition it takes, that is cancer or the cyst. Cancer is one of the most fatal disease which results in the severe stage of OSMF. If the OSMF is not treated in the pre-stage, and it may take cancer, in the form of cancer. And the areas affected are mostly the buccal areas. This side, the buccal areas are mostly affected due to the areca nut chewing, and it is seen as whitish patches which is seen in the mucosal area of the buccal area of the oral cavity. So white patches are there, and if the form is severe, or through biopsy it is diagnosed, and it can take the form of cancer also. So the one of the major disadvantage of OSMF, oral submucous fibrosis, is that it can take the form of cancer also. It is one of the most fatal disease which is caused due to the OSMF, that is oral submucous fibrosis. Now the treatment. What is the treatment of OSMF, or oral submucous fibrosis? The first most treatment is that we have to avoid, and we have to completely stop eating areca nut or any kind of products like pan, gutka having areca nut. Okay, so areca nut has to be totally stopped and eating. And second is, if the person is taking too much chilies while eating foods or meals, then they have to stop that also. So the chilies also has to be stopped. Third treatment modality is that some ointments like Kinocort, Cure Next, and many more with generic name coming in the market, that the the doctor, the dentist will prescribe that ointment you have to apply in the buccal mucosa or the areas, white patches having OSMF disease. So these ointments are quite helpful, and you have to apply it once or thrice a day according to the severity of the condition, and it will get to heal. And what are the main symptoms I have discussed in this topic, what are the treatments I have discussed, and what is OSMF I have discussed, and also the etiological factors. So guys, this is one of the most prevailing disease, because nowadays all men and also the women in some areas of the country, they eat tobacco and with areca nut and gutka and all kind of areca nut products, and some eat too much chilies. So it has totally caused a wide range of problems in people. So this is totally hampering the overall body, because the nutrition is taking the nutrition is hampered. We are not able to eat, because the mouth width is reduced due to the stiffness of the fibers which are present in the mucosa of the oral cavity of the or the areas affected by the areca nut having OSMF. So the mouth opening width is totally reduced, and sometimes the mouth is not able to open also. So the brushing technique, we cannot brush, we cannot have the food, burning sensation happens, and too much problems. And one of the major problem along that is having cancer. It can take the form of cancer. So some medicines are there. Some medicines also doctors prescribe along with the ointment, as I said, the Kinocort and Cure Next. These are the ointments we have to apply in the areas of OSMF. And secondly, the medication doses are given, that is according to the severity of the condition, the patient's present medical and past medical and also the dental history. Accordingly, we prescribe medicines doses, and the injections, the intraoral in the buccal mucosa we inject. So injections are given so that the mouth is slowly it gets to opening of the mouth, the increased width. So for the increased width we do the injection therapy. So all this was about OSMF. And okay.